prolonged bout of diarrhea or vomiting, which is a feature of communicable diseases like cholera, can cause the body to lose more fluids, resulting in dehydration. A severe case of dehydration can cause the kidneys to shut down.
The good thing about this disease is that it's preventable and is treatable if early presentation at the hospital or health facility is made. In preventing this, I would just say look at safe water and hygiene. Then you look at safe food preparation or handling. Because by the time you raise this awareness in those rural areas, like we were doing on NTA now, do on television, we go to churches, we go to some gathering to raise the awareness. By the time they see anybody that is coming down with any of the symptoms, sudden passage of watery stool, vomiting, weakness, dehydration and all of those ones. So by the time they know these early signs, they can promptly go to any health facility for treatment.
And if it is coming from anything we put in our mouths, the first thing we do is prevent it from getting into the food to eat. Things such as hand washing, proper sanitation, prevention of defecation in public sewages, proper cleaning of our gutters, proper waste disposals and waste management, proper water systems. Even if you get this water from the bowl or the wells, boiling can be a means of cleaning or decontaminating your water. We also have different companies that come up with these chemical methods which are quite inexpensive to put in the water and allow killing of the bacteria that causes, cholera.
The most important part of cholera treatment is preventing or reversing dehydration with the oral rehydration therapy, which is made up of the oral rehydration solution (ORS) and intravenous fluid therapy.
It has a spectrum. It can be mild, moderate, and severe. So for those that are mild to moderate, oral rehydration solution. Now WHO has made it simple for we have this sachet oral rehydration solution. We advise each household to have it. This bottle is 750 mils, which is not up to one. It's not up to 1 liter. So if you get one bottle of this, you get two bottles. It means you use full one and then 1/3 of it. Okay. So by the time you do that, you just pour it directly into it because you are sure of what is necessary. You pour it, you cover it, you shake it, start drinking. That one is just for you to give the child temporarily while you seek care. Normally, if you constitute that, if the person does not finish it within 24 hours, after 24 hours, you discard the remaining one and reconstitute another one. But for severe, when the person cannot take orally, so it means you have to take IV, that is intravenous, that is the one you now pass inject the IV fluid into the body system through the IV giving set. So to rehydrate the person. So once we rehydrate the person, it keeps the person alive.
Oral rehydration therapy can be done two ways. There are those that are sold in sachets. When we have people that are sick, it can be mixed 1 sachet to 1 liter of distilled water. Or for people who cannot even afford it, we have a formula: 8 level teaspoon of sugar to 1 level teaspoon of salt in 1 liter of distilled water, and it should be given at 1 liter every 8 hours for an adult, or at 100 mils per kilogram in children. This can help mitigate or slow down the progression of the disease, strengthen the patient, and aid the patient's body to fight the disease.
Currently, there are 3 WHO pre-qualified oral cholera vaccines (OCV), with the first developed in Sweden in the 1980s.
Actually, there are vaccines for oral cholera vaccines that we call OCVs. I think we have about majorly 2 of them, but there are about 3. We have the one that we call Ducora, we have Shancor, and we have Gluvicor. So these vaccines, actually, you give them 2 doses within a period of 2 to 3 weeks or thereabout. But the vaccine, I don't know if they are available now in the country. Even those vaccines too, they have their lifespan. Like I think within 2 to 3 years, the immunity of that vaccine wanes off.
It is given with 2 doses between 7 to 6 months 6 weeks apart. So from the first dose to the second dose, it should not be more than 6 weeks you give it, because the first dose only gives about 6 months of protection, and with the two doses, it can expand to as much as 3 years. Those between the ages of 5 to about 65 years can have the vaccine. So basically, almost every Nigerian, because that's our average age group, and it is given orally. It helps to reduce the severity of the disease and to reduce death in the population.
Research has shown that hydration is essential for communicable diseases with features of diarrhea. Drink plenty of clean, safe water and engage in hygienic practices, which is crucial to healthy living.